Hi, everyone. Oh, we got a couple more coming in. Thank you so much for joining us this morning, afternoon, 2 minutes past 12. My name is Callie Bain. I am the Community Engagement Strategist over at CultureWorks, and I am joined this morning also by Daniel Jones, who is our Tri-Cities Programming Manager down in Petersburg, Hopewell, and Colonial Heights. For anyone who might be unfamiliar with CultureWorks, we are a nonprofit dedicated to strengthening artists and arts and culture organizations in our community to increase their impact. And we do that through a number of ways. We offer an annual grant. That's what a lot of folks in the community know us for. We fund a diverse number of initiatives amongst artists and arts and culture organizations each and every year. And we also have non-grants programming, including some of this virtual programming that you're on right now. We offer a monthly lunch and learn, quarterly networking mixers as an opportunity for artists and arts and culture leaders to get together and share ideas and meet. And our 9th annual Artober, which is nearing its end. We have about a week and a half left of Artober. This program being one of the key pillars of this year's Artober, each week having a program with a different arts and culture leader speaking on their expertise as it relates to access and accessibility in arts and culture. So I've been really pleased with how those have gone our last 2 weeks, and next week we have our last one with Yvonne Mastromano of Virginia Voice. Super excited about that. And I hope that some of you have maybe seen, we've been offering a Pay What You Will event series in the community throughout October. So over 24 organizations in our community, including the symphony, the opera, the VMFA, have offered events, performances, classes, admission, all pay what you will pricing. And there's still a couple of events left to go throughout the end of the month. I know this weekend I'll be at a murder mystery improv show hosted by Bridge 9. That's Pay What You Will. Next week, Shaco Sessions Live. If you've never been to one of their shows out at Shaco Records, they are so cool, so special. Theirs is Pay What You Will. So a lot of great experiences at an accessible price point for you guys to take advantage of. I think that's all I have. So without further ado, I will introduce our speaker today for our third Open Doors, if I can pull up my notes. So today we have Alexis Shockley. She is the Arts Manager for the Arts and Healthcare Program at VCU Health in Richmond, Virginia. She oversees and advises the VCU Health music therapists, music and medicine faculty orchestra, arts specialists, health and wellness counselors, volunteers, interns, and several VCU clubs. She maintains the health system's 3,000 plus pieces of fine art in their collection, while curating new works throughout the 40 plus VCU Health buildings, upholding the healing environment. Community outreach, program growth, and patient experience are at the highest of priority for Alexis. She holds a Master of Fine Arts in Painting and a Marketing minor from Radford University, and has a wide array of art experience. The Art Museum Registrar at Radford University's Covington Art Museum, a K-12 art teacher, a private art instructor, and the former gallery director at Gallery Flux in Ashland, where she curated over 30 exhibitions. And I am a big fan of her and her work that she's doing over at VCU Health, and I am just so excited. Thanks for coming.
Thank you. Well, I'm very excited. Any opportunity to share about the Arts and Healthcare Program and everything we're doing, I jump on board. So I think all of you are going to be really excited and find it very interesting, all of the things that we have our hands in here in Arts and Healthcare. So we'll get started with a slideshow, but also please pop in the chat any questions, like if I mentioned something and you want to hear a little bit more about it, please just put that in the chat, tell me more, something like that, because there is always more information than what I can share just in a slideshow. So please engage, ask questions, and yeah, looking forward to sharing with you.
Yeah, absolutely. I'm not sure who we have in the room today, what your background may be, whether that be as an artist or as part of an organization. But certainly, I always stress in these conversations, if you've been at one of our programs before, we just want to honor who's in the room and what you all are curious to know. So I have some questions for Alexis. She has a great presentation for us, but please, I encourage you, if you all have any specific questions or are curious to unpack something a little bit further as it pertains to you and what you do, let's talk about it. Feel free to put some things in the chat. So without further ado, I will share my screen. And here we go.
All right, closing out something real quick. Okay. So, arts and healthcare, I'm just going to give you kind of our mission and our history, just so you can have a little background on our program. Our mission is to provide supportive care to our patients, visitors, team members, and community through art instruction, music therapy, health and wellness, visual arts, and cultural programs. So we have been around for a while. I was just telling some folks on here earlier that we have been around since 1986. Here you see some photographs. That left photograph is from our original art cart that was pushed around the hospital. That's Ted Batt. He started our program where he would go room to room and pull a piece of art out and allow the patient to pick out the piece of art for their room while they were there. In the middle, that is one of our music therapists working with one of her pediatric patients, about 15 years ago. And then on the right, that's one of, our volunteers that would come through and work with a patient and just do some art while they were having, this looks like an infusion or dialysis. So that's kind of the scope right there in 3 pictures of what we do bedside. We don't go room to room and do artwork anymore with over 800 beds, but we do provide art, music, health, and wellness. It is designed specifically for the contemporary healthcare environment. We are a diverse, multidisciplinary field dedicated to transforming the healthcare experience by connecting people with the power of the arts at key moments in their life. The arts benefit patients by aiding in their physical, mental, and emotional recovery, including relieving anxiety and decreasing the perception of pain. This is our small but mighty team, quickly growing. We will be growing by about 2 or 3 employees in the new year. So if you're looking for job opportunities, we will probably have an art therapist position posted by end of year, which would be our first full-time art therapist position, which is wild to think about for our program. And then also a pediatric art therapist and music therapist for pediatrics in the new year. We have an art specialist who works bedside with patients doing art instruction, so different than art therapy. He also assists in the installation of our collection throughout the hospital building and sound setup for our events, which I'll talk more about. We have 2 full-time music therapists, and then we have a music coordinator who oversees our VCU Health Orchestra and Wind Ensemble. We have interns, externs. We currently have an extern from VCU. We have a couple clubs at VCU that we advise that provide supportive care to our health system. I always have a couple volunteers every week from U of R or VCU. We're working on an artist in residence program and an events coordinator as well. So that's another position that hopefully we'll have soon. So yeah, next slide. So patient care, I'll start with this. That is pretty much the core of our program, is taking care of our patients. In the healthcare setting where patients' sense of control is lost or minimized, the arts serve as a therapeutic and healing tool. It reduces stress, loneliness, perception of pain, and increases the patient experience as well, and it has a positive impact on their health outcome. Leaves to shorter hospital stays, the less need for pain medication, and it also helps them to adhere to their treatment, resulting in substantial financial savings for the patients and the health organization. And there is a lot of research behind this. Really interesting research if you look into the decrease, the decrease in pain and medications when you're having music and art therapy. Next slide. Art instruction. So this was, I was working bedside with a patient, a young boy who was on dialysis for over 2 years. I worked with him once a week. He got his transplant, so we are super happy. This was last year. I always say that when we do art and music with patients, we are the one person that comes in the room that is giving this patient a choice. Often, or I would say the majority of the time, they are being told to take medicine, do physical therapy, eat this, don't eat that. We come in and we say, what do you want to do? What could we do to make your time here better? Are you stressed? Are you nervous? Are you bored? Are you sad? And from there, we just give them choice. We can do painting and clay and drawing. We tie-dye, jewelry making. Maybe it's learning a new art. Maybe I've had patients where they've never watercolored before, and by the end, they're buying watercolor kits so they can continue painting when they get home. I've had a mother FaceTime their child while they were here to show them their painting that they were working on. Just really, it just normalizes the environment and makes it a bit more enjoyable. So we offer one-on-one to group sessions. We can do group sessions as well. And like I said, learn a new craft, relieve boredom, have fun, decorate your room. Often we make things over the holidays with patients to give as gifts to family members if they're unable to leave the hospital. So next slide. Talked a little bit about this. It's kind of actually what I just talked about. And one thing that we like to encourage our providers to share with patients is that our services are all free. We do not charge patients for music therapy or any of our services when we come bedside. And this right here, this was, I worked with that little girl for over 5 years. And she's healthy and doing wonderful. But we tie-dyed a shirt for herself and for her baby doll, so they were matching outfits.
Oh.
So that was really special. This was actually a patient up on the epilepsy monitoring unit that I worked with. She wanted to do a brain sculpture. So a lot of, patients use this art to cope with their diagnosis. And this patient was never really saw anything like this, being able to really take how she was feeling and make such a beautiful piece of art. So benefits of art instruction: shortened stay, easing anxiety, depression, can inspire health and well-being. Like I said earlier, this can continue into their daily life after discharge. Creates therapeutic engagement between the healthcare workers while reducing tension in the workspace. We often do get referrals after a patient has been here for a very long time. They're no longer abiding by the medication they need to take. Can we come in and help? Can we, they're just restless, things like that. So we try to be there from the beginning to be a support, but we also can definitely swoop in and help in those harder times. Welcome distraction for team members, patients, and family members is a great opportunity for a mother, father, sibling to go get a coffee, go get a snack, leave the room, give them a break. So it's all encompassing, where it helps the providers, the family members, and the patients. So music therapy, we have 2 full-time board certified music therapists. Music therapy is definitely something that not a lot of folks know about. They don't know about the rigorous education and training that goes into becoming a music therapist. They're wonderful what they do. I shadow them often, and I wish all of you could come bedside and experience the power of the music on our patients and their family members. They can be self-referred or referred by a family member or a medical team member. So we often get patients that are referring themselves for these therapies, or a provider who notices they brought in their guitar with them, or they seem to really enjoy music while they're there in their room. So they kind of keep an eye out for things like that. So what is music therapy? I said that a lot of folks don't understand exactly what it is. I didn't when I came into this position. It is a clinical and evidence-based use of music interventions to accomplish individualized goals. It's an established health profession in which music is used within a therapeutic relationship to address physical, emotional, cognitive, and social needs of individuals. After assessing the strengths and needs of each client, they provide treatment, including creative singing, movement, and listening to music. They're able to strengthen and transfer to areas of other areas of their lives. So a really special part of the music therapy program is the heartbeat recording program that we have. I think this is phenomenal. They saw it being done at a different hospital. We have 2 stethoscopes that can record the heartbeat of our patients, and our music therapists will then take that heartbeat as the beat for a song. So as you'll see here, Molly is sitting down. She is playing the music to the heartbeat of one of her patients. And then background music by Melissa. A lot of vocals are usually put to it, and this is predominantly done end of life. Either a family member refers, calls them up and says we need to have a heartbeat recording done, and then the music therapist will talk to the family members about a favorite song that they would like. And then our music therapist will do the recording, the audio, everything, put it on a CD and send it to the family. Benefits for this end of life. It gives the loved ones an opportunity to engage in the experience. It's not centered around the medical or logistical items they're dealing with. Same with art therapy, reduces the perception of pain and anxiety, facilitates self-expression, emotional exploration, and it creates a positive memory for the patients and loved ones. Often they'll come in when they're removing someone from life support, so they're kind of not drowning out, but covering up the sounds of the machines, creating a beautiful song. Often family members will all come together and sing. So it's very powerful. So now moving into some opportunities for community engagement. I'll just stop right here. I've been yapping away, but that was kind of more the patient focused work that we do. I'm going to kind of start talking about what we do to bring in the community and support our providers. But before I do, does anyone have any questions about what we do for our patients with art and music? Nope. We can take questions at the end as well, but
Yeah.
team member support, that's something when I started about 7 years ago. Am I collecting data on my patients? I am not. We do, okay, so I wouldn't say we're not. We do have some QR codes and surveys that are out there. We have found it, and I'm open to advice on this from anybody that may have experience in this. We have had a hard time asking for responses from patients in that time. It seems kind of difficult, like, well, how do you feel now? It's more of we're not a metrics or a data. It's very hard to collect data for what we do. That's also why we have not grown as a department very much, because the healthcare system is very data based. In order to prove the need, you need to have data. Why do we need an art therapist? Well, there are these benefits that we can show through research, but we don't have any numbers. So we have started collecting metrics on numbers of encounters. So I was encountering probably around 125 folks a week with art. So in that realm of metrics of engagements, we do have that kind of data. We are currently the intern from VCU that I'm working with right now. She is collecting data currently throughout the entire health system on the team members' perception of our program and how we can better get out what we do, get more referrals, communicate the benefits of the team member support, the music therapy, what we offer patients. So she'll be wrapping up that data analysis end of November, early December. So yes, it would be amazing to get more data on patients. Our music therapists are thinking about doing I'm going to a conference tomorrow where I'm excited to get some information on data collection for patients, but we have thought about doing blood pressure readings from start to finish of patients engaging in art and music therapy bedside to gather our own data, not what we're getting from other health systems. Blood pressure was high when we was this, and when we finished the music therapy session, it was this, to show that tangible effect of what our therapies are doing. So good question. Always room to get more data. It's definitely something since taking over the program in the past year that I'm really, really interested in doing because I think that that's how we're going to have to grow as a program, is through data collection.
Nice. I was wondering if you said that it was kind of difficult for you to collect the data. Can you elaborate on that? Do you mean that, it's kind of a sensitive time and it's difficult to kind of elbow in and, try to ask questions or
Yeah, it's just kind of, you've just created this relaxing environment where they may just, you kind of step out at that time. So to kind of step in and say, ask questions for analysis after you've provided a therapeutic session, our music therapists have had trouble figuring out how to do that.
right.
So we've had the QR code here, it's on our card. Please take a moment to share with us how this experience is, but it also kind of changes what it was, were you
Right.
here to get this data or were you here to provide this comfort? So just trying to find that balance has been something we've been trying to figure out.
Mm.
How can we get involved in we just got another question. How can we get involved in something like that? Is there any place in the music or art therapy for people without a degree? So not in the therapy realm, because of the word therapy is, paired with the degree, unfortunately, but it is fortunate because they worked hard for it. But the art specialist does not need to have an art therapy degree. That is just bedside art instruction, fun, de-stressing. I do have volunteers that can come anywhere from the community that can sign up to be a volunteer with our program. And they can come in and do art sessions with patients. They could do something, play music in the lobby or in the waiting areas of, for instance, Massey Infusion Center. I've had a harpist go up on the critical care floor, ICU, and play in the hallway. So there's definitely opportunities to provide therapeutic care for our patients and our team members without the art and music therapy degree. Absolutely. So one of the ways that I do have some VCU students that are not art students, they're med students, are coming in and they're providing art sessions. I'll get to that slide in a minute, but a more encompassing is our team member support. The left here picture, I went and did an art session with the NICU staff at a clubhouse, and I made them think of words that were powerful to them. And we just kind of painted and hung out, and they really enjoyed it. And then I showed them all on exhibit in the hospital for everybody to see. In the middle, we did a paint your pet. I sketched all of their pets on a canvas for them and had them choose just a few colors to simplify it. And that was so fun. That's just in one of our conference rooms in the main hospital. And then on the right, one of the most recent, that's Jawanice. She's an artist here in the community, um, oil painter and a muralist. I received a grant from the Virginia Commission of the Arts to do a team member engagement artist in the community mural project. So Jawanice designed this mural. This is on the ground floor of the Children's Hospital in the staff elevator bay. So she sketched it on Saturday and Sunday, and then on Monday, Tuesday, Wednesday from 10 to 3, she was on site. The team members just walked through and stopped for 15 minutes and painted that mural. And then on Thursday and Friday, Jawanice just touched it up and finalized it. And the feedback from that was amazing. Just even standing there listening to the providers talking about how they didn't think they could just take some time for themselves. And then they were able to go back to work even more refreshed to provide care to patients. And it was an opportunity for, an artist in the community to get involved in the hospital. Next slide. We also have employee support programs. So if you know BJ Kosen from Gave Kosen on the top right, we have musicians coming in playing once a week. So if you're a musician, we have lunchtime concerts from noon to 1 every Wednesday in the main hospital. Always looking for more musicians. So if you know of any, shoot me an email because I want to support as many musicians in our community as possible. December, I have music every day up there. So every day of the week, there's music. It's a culmination of paid musicians in the community. I have the Harpist Association. It's like 10 harpists. They all come in and donate their time. So it's a blend of donated time and also paid musicians. We have the National Arts Program. It's our 20th year next year. It's an employee art program. I had over 250 pieces of art from employees and their family members on exhibit. We have cultural programs throughout the year. Last year, I did the Martin Luther King walk with the Department of Equity and Inclusion that went down Broad Street on a Saturday evening. We had the cultural festival a few months ago, right there on Broad and Marshall. We just did an employee fair with about 20 different tables of programming that we have in support for our hospital providers. We have a craft sale, which is just up in a few weeks. We had over 20 employees selling their crafts and their family members. So if you're a family member of an employee, you could participate. It's kind of like a bazaar just going down the middle hallway of the hospital. It's pretty awesome. And then we have Nurses Week and Healthcare Week where we provide, I had a woman from the community come in and do some sound baths for our nurses. So another opportunity for folks in the community is through holistic care as well. Next slide. Muse is one of the clubs I advise at VCU. It's a group of med students that found art to be therapeutic during their time in school, and they wanted to give back. So they come a couple times a week. There's over 60 volunteers or 60 club members now with volunteers that come into the hospital, and they go unit to unit doing art sessions with team members in their break rooms. So we're a year into that, and it's been really, really well received. So. Here's some more. That was them working with the safety department, the middle one up at the children's tower with the pediatric nurses and doctors. And then on the left was a group of med students. All right. If you're a visual artist, this will be exciting. This is our healing environment. Like it was stated earlier, we have over 3,000 originals in our collection, valued at probably 3 to 5 million. I know that's a big gap. I haven't had it appraised in over 15 years. So across 48 buildings. So that doesn't include prints. Gosh, I can't even think of how many prints we have. Every patient room has a print. So we have a lot of artwork. So the healing, architecture, art installations, natural lighting, it helps decrease the patient and caregiver stress. We really are known at VCU Health for our art collection. When someone comes here as a patient or a visitor, they're just like, I just love the art, the community art in here. Feels like I'm in an art gallery. So we just try to continue that feel and give back to the artists in our community through the collection of the art. Like I said, sculpture, ceramics, original prints, numbered prints, watercolors, quilts, mixed media. I have several open calls for art right now. So if you are an artist and you're looking to get your art in the collection, this is your time. The deadline is December 1st. It's for the inpatient liver transplant unit and the outpatient liver transplant unit. I also have the NICU, which will be coming up in the next couple months. I'll put that out there. I get a budget. How it works is I get a budget for art based on what I ask for on the blueprints when I receive those, and I'm able to purchase art from the community. So really awesome way. We take up such a large footprint here in Richmond, so I like to, decorate it nicely with our community artists. So it is mostly regional. We do have artists from all over the world in our collection, but I would say predominantly it is Richmond, surrounding counties, so artists. Yeah, and our buildings go all the way to South Hill, South Hill, Tappahannock, Williamsburg, New Kent, Chester. We're all over. I'm sure every time you go on a drive, you see a new VCU Health building, because I know I do. I'm like, oh, I didn't know that was there. I wonder if they have artwork. That's what goes through my head. But yeah, next slide. We do have 2 galleries as well. Hopefully or possibly growing by 2 more galleries in the new year, one at the Children's Hospital for patient artwork, and then one in the adult outpatient pavilion is next on my radar. But we have the Gateway Gallery on the left. That's artist Janie Penny was showing there a couple years ago. I rotate the shows every 2 months with local artists. Doesn't have to be local as long as they can get me their artwork and pick it back up. But I like to show the local artists. And then on the right is the North Hospital Ground Gallery. That's the Massey entrance down on the ground level. All the artwork is for sale. And I often change the shows depending on the cultural programs for those months. For instance, I always show the Black Artists Association of Richmond in the Gateway Gallery. And then I have a Hispanic artist showing up there right now in honor of Hispanic Heritage Month. So we want to honor all the cultures through our visual arts and our performances and music as well. So that's another opportunity, is you can submit your art to be one of the gallery shows. So if anyone is interested in the call for art or the gallery exhibition, definitely reach out to me. I'll send you those forms. Community outreach, top right was our beautiful arch from our cultural festival a few months ago. On the left, you'll see some Pocahontas Middle School students who every year they create art for us. I put them on display, and patients, visitors, team members can take the piece that they love and just take it with them. Mural on the bottom left, and middle bottom is the MLK walk last year that we had. And on the bottom, we have some musicians that were here to play for the holidays. And the top middle was a really fun exhibit that I had. It's a traveling exhibit of paintings of children with different diagnoses. So I was able to pick about 20 paintings and shipped them here. And a local artist here in our community painted one of our pediatric patients from Children's Hospital, which was added to the traveling exhibition. So yeah, lots of opportunities, and we try to be everywhere we can and supporting everybody. Open door. So yeah.
An open door.
I know, I didn't even mean to do that, but it just kind of flowed. But this is one of the paintings at the adult outpatient pavilion. If you ever, and now that COVID is on, not keeping folks out of the hospital, you are welcome to pop into any of these buildings and walk and look at the artwork. A lot of people do that at the adult outpatient pavilion, which is on the corner of Lee Street. Lee and, what is that, 10th? beautiful collection. It's beautiful views of the city, but also a really awesome collection. Folks tell me they come and they just walk the floors to look at the artwork. The children's tower, a little harder to get into because you have to be a patient, but feel free to pop in if you're around and want to look at the artwork. See.
Wonderful. I want to keep this slide up just in case anyone wants to jot down your email.
Mhm.
But okay, yeah, Mary just asked, what is the best way for artists interested in showing art in VCU Health buildings to connect with you? I see email.
Yeah, so I have a call for art for the galleries and for places where I'm purchasing art. So there's that two-tier. If you want to show your art in one of the galleries and get, I mean, I'll tell you, probably thousands of people walk through those galleries every day. The amount of exposure you get as an artist, you may not sell anything because you do have a different kind of population than someone that's coming into a gallery. But usually one sells, whether I buy one or a team member or a patient. You're getting that exposure you can't put a price on, which I know for an artist is huge. I had someone call a few weeks ago from an art show 2 years ago wanting to buy a painting they saw from 2 years ago from the show. So they ended up buying it, which was awesome. But best way, email me. I'll send you the form to submit your artwork for one of the shows. I am almost finished scheduling out 2025. I have a few slots open. So definitely email me, send me just a good a good grouping of the artwork I would see in the show. Yeah, and then if you are interested in submitting anything to be purchased, I can send that as well. Just specify which you would like or both, and I'll send them your way.
Gonna go ahead and bring us back so I can see everyone. I want to just take an opportunity again, now that we have some time, to ask any questions of Alexis. I'm not sure what everyone's backgrounds are and where you're coming from and if you're an artist or what. So if there's anything you'd want to get more information on or get some more details on. So Shauna asked, what is the location where we can view some of the art you have displayed?
Yeah, so I would say our downtown campus is the best. That's right on Marshall Street, 12th and Marshall. So you have the main hospital, you just come right in the Gateway building. If you come in Gateway right there, you just go up that huge staircase and you'll be at the first gallery. That'll be the gallery right now. Helene Ruiz is exhibiting in there right now. Really fun paintings. So you can pop up there and then just wander around. If the labels have a little clear plaque over top of them, they're part of our permanent collection. It'll have a P number with the year it was purchased, like P.16.2. So it was the second piece purchased in 2016. You can kind of wander around. The newest one, second to the Children's Tower, is the Adult Outpatient Pavilion that is on Lee Street. The first 5 floors are the Massey Cancer Center. And then goes up to 15 stories, floor to ceiling windows of the city. Beautiful collection. So if you take the elevator up to any of those floors and work your way down, the exterior hallways is non-patient area, so you can see the collection from on those walls. So.
Great. Jennifer asked, are you focusing on social prescribing initiatives within your department?
Can you?
I also don't, I'm not sure what that means.
Yeah. Yeah, please. I definitely want to answer that. So please,
Hi,
Jennifer.
Jennifer.
Hi. Sorry, I was eating my lunch, which is why I didn't have my video
It's
on.
the middle of the day.
I know.
Yeah.
So I work for Richmond Ballet. I'm the
Mhm.
strategic partnerships manager there. And we're actually really excited because we're working with VCU Massey again this year for our Cinderella performance.
Oh,
We're bringing immune compromised patients and their families to our dress rehearsal for Cinderella in February. So we're really excited to have some connection. And then we also send our Sugar Plum Fairy to the Children's Hospital every holiday season to visit patients' bedside. So,
yeah.
but on a side note, I actually work as well for a small organization on the side. It's my side gig. They're called the Benjamin Goldberg Foundation. And it's Arts and Health is what the organization does. It started from a woman whose son Ben passed away from neuroblastoma, but during his treatment, art therapy and music therapy and dance therapy was really kind of changed their story. And so she founded an organization in 2018. But we're really focusing on social prescribing, which social prescribing is this initiative that's new to the US, but countries all over the world have social prescribing. And it's essentially people can come to their primary care physician and be prescribed an art therapy class, or they can be prescribed to go to a museum, or they can be prescribed to go on like a nature trail or something. And it's really popular and big in the UK. And someone, they give you to what they call a link worker. And the link worker then passes you off to a community organization or somewhere that can provide these services. But social prescribing is essentially what arts and healthcare is. That's what you're doing. But in places like the UK, it is covered by insurance. So it is given to you like a prescription, like you would a medication. And so we just did a big social prescribing roundtable here in Hampton Roads. I'm based in Hampton Roads. And we do conferences for healthcare providers. So I just was curious if I'm trying to find who is doing social prescribing. And I think a lot of community organizations across the region are doing it, but they just don't know that social prescribing is kind of what they're doing. And we're trying to kind of push that initiative forward. So Alexis, I'll email you separately.
Yeah, no, I feel like I have,
you.
now that you've mentioned, I have, for some reason that's come in my radar like the past few weeks.
Yeah, it's growing.
It is. And I think I would really like to grow the community of art therapists and music therapy programs where we could, upon discharge, if they were benefiting from the art therapy, from the music therapy, let's continue this. And, you know, like I had said, like, okay, well, they continue watercolor painting at home, but you know, you have to continue your physical therapy when you're discharged. We should encourage them to continue the music therapy. But where would we send them? So absolutely, I would love to chat with more about that. And like I said, I'm heading to the National Organization for Arts and Health Conference tomorrow, where I'm looking forward to getting a lot of these great ideas. I try to do way too much and I get really excited about all these ideas, but I think that this is one that would be very important. So thank you for sharing that.
Thanks, Jennifer, and good to see you in your face after swapping some emails. That's fascinating. Thank you for sharing. Yeah. And then someone just wanted you to know, my name is Hannah Grace. I'm the creative coordinator for Conscious Creations, a sustainable art and fashion production company based here in Richmond, and they'll be reaching out.
Awesome.
So yeah, I mean, I'm just blown away by all the different and why I'm such a fan. There's so many different opportunities, and something, of course, Culture Works talks about a lot and has been the conversation about Richmond always is how vibrant our arts and culture here is, and I love that that's reflected with all your programming that you have within the health system as well. So I came to know your program because I am an alum of the theater department at VCU, and I know there's been some exciting, unique collaborations between VCU Theater and the Arts and Healthcare program. I'm wondering if you can share a little bit about that.
Yeah, so for many years were cultural programming. Before we had our DEI program, Arts and Healthcare really did all the cultural programming, lectures, performances. We would have folks coming in and doing, I think we've had the ballet come in and do a performance in the Gateway Ground area. But when DEI was formed, and we have a large organization now, they've taken over the programming, but we do support through the arts with the exhibits and music and things like that. But leading into the theater, so we have a theater in the Children's Hospital that opened. And currently we're working with Aaron Anderson Dr. Aaron Anderson. I just met with him yesterday for programming that theater. Currently, he's got one program a week on Tuesdays, which are students. We are working to grow that programming. There's some logistics that need to be worked out with the patient orders to leave the floor to come to the theater. So once we get that ironed out, we're really gonna bolster the programming of that theater with, gosh, I would love it to run like a, I would hate to say cruise ship, but to have something in it at all times, like a Disney movie playing in there patients just need to get out of their room. They need to get some fresh air. Let's go watch, Up is playing at 3. We can go down there. And then have Spark come in, have, the Richmond Ballet come in. There's so much opportunity on what can be done. Comedians and puppeteers and anything, just a variety. And that would really, really be great community engagement and bringing in folks from the community. So that would be an ideal scenario. We're really kind of, when you open up something like that, you hope it, is easy. It's hard. It's hard to get patients from the 12th floor down when they're immunocompromised to go all the way down to the first floor to a theater. So we're working on that. That was the position also that I was mentioning is the event programmer that possibly maybe we're working on forming that would help program that theater full time, along with the musical performances, the lunchtime concerts, and things like that. So I think there's enough for a position to do if we want it to be to the caliber of what I envisioned for it. So, yeah.
Wonderful. And for artists, musicians, actors, I use that as a big umbrella term. Are these opportunities volunteer based, or does VCU Health offer payment for their art? How does that work?
That's a great question. Like I said, with the December performances, if someone comes to me and says, I had a string trio of students that wanted to come in and play in the Children's Hospital. They wanted to come and do that, and they did a few weeks ago. They were so wonderful. I was like, would you like to come more regularly? I can pay you for those sessions. So it can be, I do have money allocated to my budget to pay musicians, to buy artwork, different budget lines. But yes, so I have money for the lunchtime concerts every week. For the holidays, some of it, like I have, I forget what, what's the name of the school. There's an elementary school that's coming and singing. It's 60 kids. They come and sing. They carol at the tower and they carol on the it's so cute. It's very overwhelming crossing 60 kids across Marshall Street to go from one building to the next, and 2 busloads get dropped off on Broad, but it is so well received and they love it. So that obviously does not cost money. The harpist ensemble, they don't charge. So it is a mixture when I do that much programming. I just wouldn't feasibly be able to, pay for music every day. But yes, there is a budget. So if you were to want to play here, we would be able to pay you. Artwork, every building has a budget for artwork. So the artwork that's selected for that is purchased. Yeah, so love to give back to the community when I can. So.
Yeah, and I have another question. I know you talked briefly about looking to have an artist in residency program.
Yep.
Do you have any other details about that, or what people should look out for if they're interested?
Yes, I have a 2, 3, 5-year plan for this program.
Oh, wow.
The 5-year plan would be, gosh, I would have a plethora of artists in residence. I'd have someone that comes in and does music. I have a theater person that comes and does play therapy. I have somebody that comes and does writing, journaling, poetry. So I would like to have like 5 core, all disciplines, so that anybody and everybody, no matter what they need, they could work with an artist in the community. Ideally, I would just start with one. And I have a few ideas of some artists that I'd like to work with it's difficult if you work with a patient bedside, it's challenging. So it takes a special person, which to be able to handle what you're going to see working with a patient. So I always tell artists and folks here that to keep that in mind, you are coming into a room where someone is their most vulnerable and not in a good place. So energy, excitement, being able to just carry on conversation is super important on top of the skills of an artist. But yeah, I'd like to start with just one artist and have a special exhibit of the artwork created during that time in one of the galleries. There's a lot of health organizations, arts and health organizations that have just a huge artist in residency, picture discipline. You can like choose which artist you want to work with as a patient. I mean, that would be ideal growth, because art therapy is much different than art instruction working with an artist. That's such a different experience. So I think it's important to keep both of those in the environment working with patients. So yeah.
Cool. Well, any artists on the call, I don't know, but keep your eyes peeled.
Yeah, and I would
In
hope it
1,
would
3, and
be
5 years.
yeah, and it would be I wouldn't expect it to be an unpaid internship. It would be a paid artist in residence program. And that takes time to build that budget and, like I said earlier, justify the need.
Right.
So
Right.
yeah.
Absolutely. All right. Well, final call for any other questions that anyone has for Alexis about how to get involved, things that you can do if you're interested. Again, let's see, I will briefly share the screen again so that anybody who wants to jot down Alexis's email. Feel free to get in touch about submitting for the gallery spaces, being a part of the collection, musician opportunities, theater opportunities. It sounds like a little more slow rolling, but they're there. Um, I think it's so cool that the artist community has access to providing art on this level. I know it is very, I'll speak for myself, very impactful when you get to have that, not only get to practice your art, but get to practice your art on that, kind of elevated level and see the impact you get to make. And I think it's so wonderful that we have this opportunity here, and I'm excited to be a fan and watch the program grow and evolve. And thank you for joining us today. I really appreciate it.
Thank you. Yeah, this was really fun. As you can tell, I really like talking about the program. I didn't think I'd be able to use an hour, but I probably could have talked even more. Yeah, please reach out. No question is too small. And I'd love to talk further. Any ideas anybody has. I'm open to ideas, or if you've seen a program like this before. That's why I'm excited about the NOAA convention is seeing what's working in other places. So thank you for tuning in. Yeah.
Great. Yeah, and thank all of you who hopped on the call today. We have one more of these open door programs next week. We'll have Yvonne Mastromano on. She is the CEO of Virginia Voice. Virginia Voice provides accessibility services for low vision and hard of hearing members of our community. They serve over 11,000 people who use their services. So if you are an artist looking to dedicate some time to helping, or are an organization seeking how you can bring accessibility services and reach more diverse audiences with the work you're doing, that'd be a great call to jump on. And that's our last one beyond our monthly Lunch and Learn program. So get involved, and thank you, Alexis. And I hope everyone else has a fantastic rest of your day, and take care.
Bye. Thank you.
All right, thanks.